Hello viewers, this is the part 2 regarding somnambulism disease condition. Okay, in this we are discussed for some of the clinical manifestation. Okay, in previous video we are discussed half clinical manifestation regarding somnambulism. Okay, in this the clinical manifestations like remaining one, the child doing some activities. Okay, who are suffering with the somnambulism disease condition, they are doing some activities like dressing or undressing. Okay, continuously they are trial this younger or elder sisters or elders who are there in the family. Okay, those members dresses they are trying. Okay, always they are using for dressing. Okay, many dresses, many shirts they are wearing. Okay, many tops they are wearing. Okay, why? Because this is a one clinical manifestation for somnambulism. Okay, they are interested for wearing the many number of tops or many number of shirts. Okay, this is the one symptom. Next, another symptom like sometimes they are doing the undressing. Okay, they are not interested for wearing a dresses. Okay, always they are look like with undressed child. Okay, then they are not interested. Some child wearing full dresses. Okay, some child for complete no dress. Okay, complete body will be empty without dresses. Okay, always the child will happy without dress only. Okay, some child happy with full dresses. Okay, this is the clinical manifestation regarding somnambulism. Okay, next another symptom like open and closing doors. Okay, always they are playing with the doors. Okay, the child will be opening doors and closing doors. There is no situation for open and close, but the child will be happy when closing door, when opening door. Okay, when we are all members leaving the home, then only we are closing the doors. Okay, or sometimes any disturbance will be there in the outside, then one reason for the closing door. But without reason, without disturbances, the child will be normal activity. They are playing with the opening door or closing door. Okay, some other person will enters into the room, the child will be immediately closing door. Okay, they are not enters in my room. Okay, this is my room. Okay, like that the child will speak. Okay, sometimes the child will some family members will be stay in the room. Okay, the child only go outside, the child will be close the door. Okay, this is the one type of habit of children. Okay, many of the children doing this activity, open door, close door. Okay, unwantedly, unfortunately, accidentally they are doing. Okay, unreason, there is no reason for closing door. Okay, some children means two members of children is there in the family. The mother or father went for job. Okay, the child, female child and male child playing with the one to other. Okay, the male child suffering with the somnambulism disorder. Okay, the male child, the female child stay in the room only. The male child only single go out and he is close the door. Okay, from the day, okay, from the morning to evening, the female child will be crying in the room, but there is no response by the male child. Why? Because the child suffering with some mental disorder like somnambulism. That's why there is no response for the crying of female child. Okay, this will be very dangerous to the children. Okay, that's why we have to identify, is there any sleepwalking in the children? Okay, why? Because there is no any problems to the outside children. Okay, only problem to the inside children. Okay, the female child will be full crying, full stress, full tension. Okay, single or individual, only I am only there in the room. Okay, any devil will come. Okay, like that the child will be suffering with so much of tension and stress. Okay, for preventing this problem in the early stages, we are identified for the children is there any problems. Okay, next sometimes the child will be switch off or switch on the light. Okay, they are playing with the switchboard. Okay, continuously on of the light and off of the light. Okay, switch on light, switch off light. Okay, switch off fan, switch on fan. Okay, like that the child will playing with the switchboard. Why? Because they are suffering with this problem of somnambulism. Okay, in continuously they are doing means it is a one disorder. Okay, in the day or when we are wantedly means in the night time we are switch on light means this is a one reason. Okay, in the early morning we are switch off the light means okay we have bright light by the sunlight. Okay, that's why we are switch off the light. This is the one reason. Okay, without reason. Okay, in the night time there is no reason for the on and off of the lights. Okay, especially in the children they are doing these activities, open door, closed door, or sometimes all family members or all children, two or more children or one individual child will be stay in the room means another child, okay, who are suffering with this somnambulism disorder. Okay, the child will come and switch off the light. Female child stay in the room. The male child will close the door. He went outside. Okay, in the dim light. Okay, by closing door, the female child full crying. Okay, this is the clinical manifestation we are identified in the children. Okay, next another symptom like during this episode the child cannot be awakened. Okay, in this time, okay, when the child will walking in the sleeping, when we are giving any efforts by the individual, okay, any response or any signals we are giving to the children or calling the children means there is no response. Okay, when that episode duration 15 to 20 minutes completed, then only the child will respond to your sounds. Okay, the episode, the duration can't close or reduced means there is no response when you are doing some sounds. Okay, these are the clinical manifestations we are identified in the children. Okay, next we are going to discuss about management for the children. Okay, what is the management for the children? How we are controlled somnambulism in the childhood stage means as a parents in early stages we are identified these clinical manifestations. Okay, the child is any walking in the sleeping or the child is doing good cooperation or abnormal cooperation, or the child having any activities like dressing or undressing or open closed doors or sometimes switch off the light or switch on the light. Okay, this type of activities is there repeatedly, severely, excessively. On the full day they are doing this activity, they are not response to me, they are not eat well, they are not communicating with them. Okay, this type of abnormality is there in the children's means this will be identified by the mother only. Okay, after identification, after collection of history from the mother, okay, we are decided the child will suffering with the night walking. Okay, this time we are doing the some management like we have to provide light diet to the children at the night time. When we are giving dinner to the children, okay, we are not provide hot diet. Okay, we are provide only liquid diet for easy digestion. Okay, when the child will be easily digested, there is no problems of digestive system, indigestion or vomitings or motions. Okay, the child will feel a good sleep. Okay, the child will feel comfort. Okay, next for improving child health, we have to provide light diet to the children. Next this is the major step for the pleasant stories at bedtime. Okay, when the child is go for bed, as a parents or as a grandparents, we have to give pleasant stories, pleasant music or pleasant environment we have to provide for the children. Okay, for avoidance of sleep disturbances. Okay, for improving good sleep, we have to tell good stories, pleasant stories, happiness. Which story will give some happiness to the children? Okay, that type of stories we have to give children. Okay, when they are go for the bed. Okay, next sometimes we have to prevent the exciting games. Okay, when the child is go for bed, okay, during that time we are not give any exciting games. Sometimes they are playing with the games. In that game, what happened, like that, some excitement is there. Okay, for prevention of that excitement, we have to give not give any excitement games for playing at the night time. Okay, next in this we have to give exciting pictures we didn't show for the children. Okay, we didn't show for the excitement pictures for the children when they are going to sleep. Okay, next frightening scenes or sometimes frightening stories is there in the movies. Okay, that type of frightening stories we are not showing to the children, we are not telling to the children. Okay, any frightening stories like sudden accident is there, or sudden murder is there, or sudden death is there in the family or outside family or neighbors or siblings. Okay, any accident stories or any frightening stories, any dangerous scenes, we are not tell for the children at the night time. Okay, next sometimes as a parents we are provide for the comfort bed to the children. Okay, comfort room, comfort environment. Okay, dim light. Okay, comfort bed. Okay, pleasant stories. Okay, pleasant activities. Okay, the child will be happy, then only the child will get the good sleep. Okay, next emotionally healthy environment. Okay, any sad news or any unhappy news or any tensions or any anxious news is there, that will be avoid in front of the children. Okay, next another management like in case of sleepwalking. Okay, in case of sleepwalking in the children, as a parents we have to close the door. Okay, we have to close the door and windows. Why? Because sometimes we are sleeping means the child will have sleepwalking means okay, we are stay in the apartment like first floor or second floor means the child is easily open the child when sleepwalking. Okay, when the doors will be open means the child will be unconsciously they are walking and they are fall down. Okay, sometimes for prevention of disorders, for prevention of complications, okay, for protecting child from the somnambulism, always we close the door. Okay, for maintenance of good health of the children. Okay, this is the major management. Always close the door who are suffering with this type of somnambulism disorder. Okay, next sometimes we have to improve some prolonged problems, mental problems is there in the children's means for protecting child we have to give psychological therapy by the psychologist. Okay, we have to consult the doctor for treatment of any physical disorders. Okay, is there sometimes physical disorders is there or some sleep disturbances is there by the tension or anxiety. Okay, in the time we have to meet the doctor. Okay, by giving the doctor will give some advices, some suggestions to the children and parents, some support they are giving, okay, for reducing their problems. Okay, this is the management for the somnambulism. Okay, thank you viewers.